First there was Botox, now the FDA has approved another filler to help wrinkles vanish. Cosmetic surgeon Dr. McIntyre Bridges with Bridges to Beauty joins us to talk more about this latest treatment option. He'll be answering your questions for the next half hour, so we really want to encourage you to ask the questions on your mind. If you're right there online at KTBS.com, just click on that orange Healthline 3 box. That takes you to this webcast, which is of course streaming live. You can submit your questions right there. You can also take part in the webcast right there at KTBS.com, or you can give us a call during this show, 318-219-4569, the number right there on the bottom of your screen. We'll be taking your calls and your questions until 12:30. Dr. Bridges, thanks for coming in today.
Always a pleasure.
Now this is actually called Belotero. Am I saying that right?
That's correct.
Belotero. What exactly is this?
The Belotero is a new type of fill that basically is approved for very fine wrinkles around the mouth and the cheek regions. There's other fills, okay, that basically are good for deeper areas and for, I guess, more coarse type of wrinkles like the juvederms and the radius for the nasolabial folds. But it's always been hard to treat very, very fine wrinkles around the mouth and things with those because they're much thicker, okay, and they're made of hyaluronic acid, which is a thick substance anyway. This is made out of a synthetic collagen. Unlike the old collagens we used to use in the 1990s, which were bovine collagen or from cows, this is a synthesized sort of a human collagen, okay, which they've cross-linked to make it last longer. But it's a thinner product. Therefore, we can push it through a much finer needle, okay, in areas of fine wrinkles. I mean, I think it works great.
So that's really the trick, is having a smaller needle, and it's the solution is actually thinner to kind of go through.
Yeah, it's not. It's a still type of gel, but it's about half the thinness of like the juvederms. Juvederms is not quite like a putty, but it's fairly gelatinous. This is about half that consistency. It flows real easy. You can put it where you want to, and you're shooting for areas in the dermis, which is that very top layer of skin, whereas before you always had to put it under that layer to attempt to prop it up. This just works so much better. It flows through the finer needles easier. You need the finest needle that you can have to get the small wrinkles.
Right. So Dr. Bridges, this procedure is kind of for the really light wrinkles, maybe the ones around our eyes, the ones around the corner of our lips?
Yes, they are. Around the eyes, it works well. I would use it in conjunction with some Botox, though.
Right.
Again, if you use Botox and the wrinkles go away, then you don't have to use anything at all. But if you're one of those people who have kind of etched a line in the skin, and even though the muscles are relaxed, you still want to get rid of that line, which is usually less obvious, then you would use the Belotero.
Okay. What about those deep wrinkles that we see sometimes? What would we use for that?
Well, like the most common wrinkle in this region is that what they call the parentheses, which is the nasolabial fold, and extend down to what is called Mariette lines. You know, I use the juvederms and the radiance there because you're putting things deep. There's not a need for something thin. The Belotero and things being thin and made of different substances, it'll last about 6 months, whereas the radius and the juvederms usually last about twice as long, if not a little bit more. But you'll use those in areas that you need more structure. Okay?
Right.
In the very superficial layer of skin, it's not so much structure as it is kind of using a little putty to make that line go away.
Right, just kind of smoothing it out. We actually have Kate on the phone with a question for you now. Hi there, Kate.
Hello.
Hi, what's your question for Dr. Bridges?
My question is does this new injection require the pre-collagen allergy testing?
That's a good question. It does not. It does not. The bovine, we used to have to use that all the time. We have to inject it, and wait about a week or so, see if they got that little wheal or had an allergy to it, which wasn't very common. But with this, you don't. It's the old collagens were like a cow collagen, and even though it's real similar to our collagen structure, there were some variances, and some people would react to those.
Okay.
This is a synthesized human collagen, and so therefore it's compatible with humans, so you don't have to get those test doses.
Okay, and may I ask one more quick question?
Yes,
Go right ahead.
How does this new injection compared to Restylane for fine lines?
Now the Restylane for fine lines, it was good, but again, I thought it was a little bit thicker. I had trouble putting, the trouble that you run into is that you're trying to use the smallest bore needle that you can. Okay, and the thicker the substance up, the more pressure you have to put behind it. The more pressure you have to put behind it, it would tend to kind of knot things up. Okay, or the worst part was that sometimes the needle would come off. It would just explode and things, and then you're wasting all things. With this, it's about half the consistency of your regular radiuses, and I just find it slow. It flows easier. You can manipulate it easier. You can smooth things out, and then it melds in real nice over the next couple of days. It didn't leave that little. Sometimes you have a almost little bead kind of feeling after the other ones.
Okay, thank you.
Okay, you're welcome.
Thanks for calling, Kate.
You're welcome.
If you have questions for Dr. Bridges, we invite you to give us a call. 318-219-4569 is the number to call. We're also taking your questions online over at ktbs.com. So, is this permanent procedure?
I don't think it.
No,
none of them are permanent things.
None of them permanent.
Yeah, because our bodies always remodel stuff. Okay, even hyaluronic acid, which is found in our joints and stuff, it's always being replaced. And you're using hyaluronic acids like the Juvederm in the Radiance, or was another type. But even though they're cross-linked to stay around longer, your body kind of overcomes that. Okay, it doesn't. It's not like if it overcame it, thinks the next time you do it, it would be shorter. It just each time it overcomes it.
How long does it take you guys to perform Belotero?
It takes about 15-20 minutes.
Okay, so not long at all.
Yeah, I'll have people come in maybe a little bit earlier to put a little numbing cream on, because when you're working in the dermis itself and things, it does tend to sting a little bit more. I mean, it's not bad. We're using a small needle and all, but just for comfort's sake, it's not a bad idea. For if you're doing things deep, once you get through the skin itself, the soreness isn't that bad, especially if you're able to mix the stuff with a little bit of lidocaine. Like the Radius, you can mix with lidocaine, Juvederm. Some Juvederms come with lidocaine, so there's a little stinging, but it quickly goes away.
Right. And as far as recovery time, you said folks are back at work the next day. Yeah.
Again, you want to avoid best you can anything that's going to thin the blood, like your aspirins or your ibuprofens. Aspirin, if you can stay off it a week, that'd be good. Your ibuprofens a couple of days is fine, because being superficial again, you can get some bruising. Yeah.
And you were saying earlier this treatment lasts about 6 months or so it's something you would come back and get redone every 6 months.
Yeah, the majority of people last about 6 months.
Okay.
Before the body kind of clears it. But I think it does leave behind a little bit better structure, so I think the appearance even looks better even after it's gone.
Really? And can any age get this procedure done?
Any age can do it. I mean, I haven't seen anybody in 16 yet. But
right. Never say never, right?
Yeah. But it's usually most of the ones that will come in for the little fine lines are somewhere in their late 30s, early 40s. After that point, they might have thicker lines that might require something else. But those are probably the populations that you'll see the most.
Right. And this was recently FDA approved over the past year, right?
Yeah, it's approved specifically for fine wrinkles in this region here. I mean, you can do it around the eyes. But again, I'll treat it first with Botox first and see how much it shakes out. You just can't treat a lot of Botox around the mouth, because it will, you depend upon some of those muscular movements to talk and to look normal and things. And I will use it in the chin, because some people have those little almost like little puckers in there, and that's due to muscle pull. That works very well too. But it lasts as long, if not longer, than if you try to inject those areas with that little Belotero. But the little fine liners, which aren't muscle controlled, I mean, it's a very nice product.
Right. When talking about Belotero, will the treated area become hard or maybe feel a little bit unusual following the procedure?
No, it doesn't. I mean, it unlike the thicker Juvederms and Radiance and stuff, and if you put it deep, you can still feel a little bit of firmness for at least a couple of weeks or so. This is so pliable, and it blends in so nicely and things that even right afterwards you could barely feel it, and the next day you don't feel it at all.
Dr. Bridges, what are our price ranges when talking about Belotero?
Now, the Belotero is probably around $400, between $350 and $400.
Right. Yep. And again, that's lasting for 6 months. So, 6 months, every 6 months, about $400 or so. What about Belotero? Would that work to remove a person's under eye circles? I know that's a lot of women have problems with those big bags.
I mean, you could use it as a generalized fill, but I wouldn't do that, because the other fills around the eyes and stuff, we tend to lose cheek tissue over the bone here, okay? And as we get older, we get what's called tear trough deformity, which basically, that means the lower curve to the eyelid becomes elongated, okay? And it's due to loss of tissue, okay? And so, using the other fills, which last longer, a year, with the radius, sometimes it lasts, a year and a half, would be a better option than to use something real thin and to stick it real deep and then to fill stuff up. So I use all those, but I use them specifically for certain things.
Right. Let's kind of touch on some advantages of using a Belotero filler in comparison to maybe some of the other products. Say Botox, Juvederm, advantages.
Again, the advantages is for really small wrinkles around the mouth and things. You can use it around the eyes. Botox is not a fill. Basically, it paralyzes the muscles. And when you paralyze the muscles, those wrinkles that are due to muscular movement, okay, which are, glabellar region, the forehead region, things around the eyes primarily, are easy to treat. People in their 30s, maybe early 40s or so, that basically have wrinkles only when they smile or only when they frown down, does real well, because they won't have any wrinkles after that. The skin, depending upon the person, stuff over time becomes more plastic-like than elastic-like. Okay, and these muscle movements around the eyes and the forehead region, basically it's like taking that piece of plastic and bending it back and forth, back and forth, back and forth until you etch the line in it. Okay. If you use the Botox, you'll still have the line. I mean, it'll probably be 80% improved, which most people like. If you really want to get the rest of it, then you use the Belotero to fill in the rest of it. I never use fills as a substitute for Botox, when Botox will always do better in this region here.
Right.
The reason being is that if let's say you don't like these lines, and I go and I fill them up and things, and they look great and things like that, it'll be a short period of time before that comes back, because you still have the muscle movement, which causes the wear and tear, and all you're doing is just squeezing that stuff that I just injected, that's very expensive, that I just injected there, out.
Right.
Okay, so you want to take care of the muscle mechanical features that cause the wrinkle first,
right?
Okay, and then decide if you actually need the fill. Most people won't need to fill. Some people do, but if you get those muscles under control, they're very, very happy just with the Botox.
So somebody coming in would first have Botox performed, and then if they want maybe some of the finer lines, that's when you would.
If they came in, let's say they came in and they had wrinkles and stuff around here. Okay, I'd say use Botox first. Okay, I wouldn't use a fill, just because 90% or more will like the results of the Botox alone.
Right.
All of them will like the results of Botox. It's just that some will want a little bit more things. And again, I would never use a fill as a substitute for Botox in areas around here, because you would just be wasting your money. If you don't use that Botox and you don't slow that muscle, because everybody's animated, they're squinting, they're happy, they're sad, whatever. Those muscles are moving that skin, and wherever you put that fill, that Juvederm or Radius or even the Belotero, it's working against it. Okay, I mean, and it won't stay smooth very long. Okay, not like you predict, 6 months or a year. It won't go half of that, I bet. Okay, so Botox here. Now, if you're talking about wrinkles around here, okay, this isn't an area that you Botox very much. I mean, you have to be very, very selective on what you do around the mouth, because you don't want to change their expression or their ability to eat out of a spoon or anything.
Right.
And so, in those, because those little fine wrinkles really, aren't as muscularly caused as around the eyes and stuff, then you fill in with the Belotero. So if someone comes in and says, I don't like the wrinkles here, I don't like the wrinkles here, I'd use Botox here, I'd use Belotero here.
Okay, interesting. And what is Belotero made of? I know you said it's a lot thinner than your Botox, but
it's a type of collagen, but it's a synthesized collagen. In other words, it comes out of a petri dish. Okay, there's been several different types of collagen in the past. The first was bovine collagen, where whatever left over from that cow, because that, they ground it up and things and mixed it up where it was sterile kind of situation, and you injected that. Okay, species to species, collagen basically is fairly similar from one species versus another, especially in mammals, right? And so you can use that stuff, and it will stick around a reasonable amount of time. It would do 3 months to 6 months and stuff, depending upon the person.
Right.
But collagen, we have lots of collagenase in our bodies, and that's an enzyme that breaks down collagen. So it doesn't stick around as long as the other ones did or do. And the thing with the bovine collagen, you always have to do like a little test dose, like a little TB thing, to see if you would have a reaction to it first. Because the last thing you want is to inject it and them to have a reaction to it.
Exactly.
Okay. So, and most people didn't. I mean, it's probably less than 1% or so that had a reaction to the bovine collagen, but still, it could be a significant reaction. Then there was human collagen, okay, which was basically cadaver collagen. Someone died and things, and they took that collagen and they processed it the same way they did the cow collagen, and you injected that, but you didn't have to have a test dose to see if you reacted to it, because it was human, and so it's really the same structural collagen that you normally have, but it just didn't last as long, and now there's the Belotero, where basically they took some fibroblasts and stuff, and they put them in a petri dish and grew up, the product from fibroblasts is generally collagen.
Right.
Okay, and then they took it out of the soup and things, and they spun it down, and they developed this gel with it.
Okay.
And so since it's human collagen, you don't have to have a test dose again.
Okay. And so this has been around, like we were saying, for about a year or so?
About a year or so.
And FDA approved. Any negative effects of this?
No, what you'll find, though, I mean, it's not negative from the standpoint of the material. I mean, they always put on those little pamphlets, reaction and all this stuff.
Right.
But what you'll see sometimes is that bruising. Like I say, it's fairly superficial. The dermis has lots of little capillaries in it. After I get through all those holes from pressure on there, just to kind of minimize that. If you're doing, deep nasolabial folds, there's not a great deal of blood vessels deep in there, so most people don't get any bruising from that. But the more superficial you get, the more bruising you can get. So you can, go out there and buy some dermal blend, so just in case. But it resolves fairly quickly.
Dr. Bridges, I think something that some women out there are scared of is too much Botox, too many fillers. It's not going to look natural. Is this something that you tell, that you'll kind of let women know?
Yeah, I caution them against that. I am not one who wants to see 100% of the facial animation from here up go away.
Right.
I think they look like these baby dolls that when I was growing up and things.
Dolls,
your sister has this little pedestal job, and all that moves is those eyes. And you kind of go, that looks a little freaky. So I tell people, basically the amount of Botox that you use and stuff, which is fairly standard and things. But some people, some injectors will go, I think, a little overboard with it, because I think it looks a little freaky personally. Right. The fills, the only thing you want to avoid is these people that come in and want these big old lips and things. That's not natural, and most people can't do that. And what they don't understand is, Angelina Jolie can get by with it, because if you look at her lips and things, you look at most people's lips, there's a portion of your lips that's supposed to be on the outside. Past that line is mucosa, which basically is little these little glands that secrete mucus and stuff. And if you make it real big, you'll roll that out, okay, and you'll be licking your lips all day long, because it's like having a chapped lip.
Right.
And so there's it's probably 7% of the people I see that you can actually make the lips kind of big, but I never like that. No, most people don't look real normal, or it looks disproportionate to their face and stuff, that they have these big old lips and things. Most people don't ask for that.
Right.
Okay? They want younger looking lips, and when you talk about younger looking lips and stuff, it's a twofold feature. Okay, most of the youth of the lips are from the outlines. In other words, you have normal skin and things, then you have the pink stuff, and in between those two, there's a little line here and a little line here called the white roll. Okay, if you look at a child and things, they have very, very distinct features. Okay, in the filtral columns and things, you really want to build those up. You really want to just sharpen those up and things like that, and then what little stuff over you can put in the lips to kind of make them a little bit fuller. But most people will look, much younger or look much sharper and things if you just sharpen up those features, because they always flatten over time.
Right.
People lose that filter column; it just gets flat. People always lose the white roll; it flattens too. It's just a time issue. But if you're going to make people, like I say, I think lips look fine, when those things are sharpened up by themselves a lot of times.
You mean sharpened up, you would just touch up certain areas on the lips, or would you touch up the actual kind of wrinkles on the outside of the lips?
Well, on the lips, both of you can do, but on the lips, again, if you look at a child, okay, or a baby and things, and you look at their lips, they're full, but if you really look close and so that they have sharp filtral columns, that's those two lines that come down,
Yeah, okay.
They have a sharp demarcation between, it's a fibrocartilage structure, okay, that basically separates normal skin, which you can't see around my little hair growth.
Well, facial hair, right?
I know. And then the pink part. I mean, there's a sharp line, and it tends to jut out just a tad and things, and that's called the white roll. It's in the upper lip and it's in the lower lip. Okay. Those are what you make a little bit bigger. You sharpen them up because they always flatten. The women that come in with those little lipstick bleed lines and stuff, it means that portion of the white roll basically is kind of broken down. Okay, and it's due to that mechanical movement of our lips back and forth. But you fill those up too, and then you fill in those little lines with you can use Juvederm and things. The Belotero will work fine too. But it's these here. Then you take whatever's left over and you do some fills out superficial. Now generally, 1 syringe of the Juvederm will do the lips, and then 1 syringe, plus minus, of what I call the radius stuff will do these. I like to use radius here just because you get a cc and a half versus volume versus 0.8 cc's.
Right.
So the cost is the same and things. So basically, and radius does last longer. I like the volume, and I like the things when it comes to nasal before or marionette kind of lines.
Okay.
Marionette things. Again, with the marionette things, you'll feel anything you inject in there for a little bit in terms of the Juvederms and the radius, but that all goes away. No one sees it. It's just basically that's just part of that process.
Interesting.
Yeah.
If you have questions for Dr. Bridges, we invite you to give us a call. 318-219-4569 is the number to call. We're also taking your questions online. Just head over to KTBS.com. I know Christmas, the holidays, are, of course, are right around the corner.
Yeah.
I'm sure you guys see a lot more women coming in around this time of the year saying, do this, do that. What are some of the common procedures?
Oh, well,
Let the list begin, right?
There's a lot of them. Certainly the fills and the
Right.
Botox. I mean, again, they want to, if you're going to do the Botox, you want to do it at least a week before whatever comes up, because it takes about 3 to 5 days for it to set up. Also around the eyes, so some people can get some bruising. Oh, it's not common, but you want to hold a little pressure afterwards, which I do. But you don't want to be going to a wedding and things and have to cover up a little bruise or something along that.
Right.
So give yourself some time for those. When it comes to the fills, which is over the Juvederm, Radius, and then the Belotero. Belotero, you really want to give yourself a couple weeks because again, its incidence of bruising can be higher than your other ones. Okay, and so, but it does help those lines a great deal. With the Juvederms, because you're usually going low, or the Radius because you're going deep and things, the bruising is really not that big of an issue. And generally it doesn't. I mean, the Radius can have a little more swelling, but it's not that bad. And you look normal when you leave, and you look even better, the day after.
Right.
If you're injecting the lips, again, avoid the aspirin stuff. Some people I've seen bruise reasonably well with with injections into the lips. It might be 1%, but they'll.
So when bruising on the lips, are lips swollen and bruise around the outside, or how?
Really, most of the bruising will come when you're trying to make the pink part, the pinker part bigger and things. It's surprising how rapidly they'll get big sometimes.
Right.
But again, you want to avoid any aspirin.
Right.
And I'll be as careful as I can.
Of course.
But it's a rare incident, but I certainly have seen it.
Speaking of lips, Meredith has a question online. Meredith says, what type of injection do you use for the white rows of the lips?
White roller of the lips and stuff. It's I primarily use the Juvederm, the thicker Juvederm, because it lasts longer. With the white roll, it's superficial, okay, and you need something clear to inject in there, and that's your Juvederms. Okay, I don't use the Belotero because it wouldn't last as long. Okay. It would probably give you the structural, shape and things, but it just wouldn't last as long. You might as well, get the longest you can out of these things. I don't use the radius there because it's white, okay? And even though it's called the white roll, it's not supposed to look white. And so if you're injecting radius real superficial things, you might see it, okay?
Right.
And it tends to be a little lumpier in that region.
Okay.
In other words, you can feel it. I mean, you don't see it, but people will feel it, and people, get a little bit. Some people are real touchy-feely. So
Right.
they don't like that as much. So I like the Juvederm.
When talking about cosmetic procedures, can these, if something goes wrong, can it be reversed?
Well, yeah, I mean, like with the Juvederms and the radius, if they don't like something within a couple of weeks, and I really haven't had to do this, but
Right.
I'm just asking, answering a question. You can come in and things, and we numb it up, and then you can kind of press on it to get it smoother, or something along those lines. It's not hard to do.
Right.
The radius and stuff, like I say, I don't do radius really in the lips. Again, I do it nasofold and marinate to kind of turn up the corner of the mouth and things. But I remember there was this patient. This was done someplace else and stuff, but they had done the radius in the lip, and again, it looked fine. But she just complained about the lumpy, bumpy feel when she go to lick her lips and
Right.
stuff. And the person going to do it basically had to end up kind of making little decisions and taking that stuff out because it's not real moldable. Radius itself is not real moldable after a couple weeks, and so that's the only thing I've ever heard. Again, obviously that's real rare.
That wasn't one of your patients. You just
It wasn't
heard
one of my
about
patients,
that.
and again, it's incredibly rare. But
Right.
again, I mean, if you ask a question about what can
Right.
go wrong, kind of
Right.
situation,
Just
things.
one in a
Right.
million,
Yeah.
maybe.
Now with the old collagen, which we don't use anymore, and things, people used to get what was called granulomas, which is really a kind of a foreign body reaction to it. And it's been reported with the radius. I haven't seen it. Radius is different. The radius is it's little ground up pieces of coral. And the reason you can use it because it's the same structure as our bones. Okay, it's calcium phosphates, and so it's not something your body rejects. It's just that for some reason, in an incredibly rare number of people and things, you inject it and things, and then it starts to swell a bit and things. At least this is what you normally find, and then it would just become real firm. Okay? Eventually, that goes away because your body does get rid of all these things. But that's the only other thing that I can think of that. Might happen. I mean, personally, I haven't seen it and things. Will I ever see it? Maybe.
Right.
Yeah.
Right. Any advice for someone who's about to get some kind of cosmetic procedure done? Something that stuff that they shouldn't do before coming in to get a procedure performed?
Well, like injectables, you want to avoid any thinners.
Right.
A lot of people come in nowadays for that laser resurfacing. It does a very, very, very incredible job. Especially, I find it works great on these women in their 50s and 60s. They have that real plastic skin, and just every line goes this way and this way. They'll need free treatments and stuff, But even after the first treatment, even though I'm seeing, you still got some wrinkles and stuff left and things, they go, oh, that's incredible. I go,
Right.
okay, this is great. But it's that smart skin. It's a CO2 laser, and the downtime's not that bad. Not that bad. But people will have that, and they'll be ready for, the parties and things.
Right.
And of course, we have the hydrofacial. People come in and get skin cleaned and stuff, and it's like a microdermabrasion, but it's done with a serum. So they don't have that kind of scratchy feeling sometimes, and they go out kind of moist, and it does put moisture in the skin, so it just looks better from that standpoint.
Once again, we only have about a minute and a half left before we have to say goodbye. But Belotero, which is what we really wanted to touch on today, this is just a procedure that you've been performing over the past year. FDA approved, actually.
Right.
So relatively new still. This is really just to try to get those thin wrinkles that maybe things like Botox can't get to, and just to give your face that overall smooth look.
Smoother look. That's correct. Yeah, and it really does help smooth those areas.
And again, this is a procedure that takes 15-20 minutes, you were saying, and recovery time, you're back to work the next day.
Sure. Yeah. No doubt about that. Like I say, you want to avoid those blood thinners.
Right. Right.
we were doing it on my nurse at first, and so that, she had a little bruising.
Dr. Bridges, if someone wants to schedule an appointment with you, what can they do?
They can call the office. It's 318-219-8555.
And you guys are right there off Uri Drive.
Yes, we are. Right, just south of Broadway Baptist
You'll
Church.
see the big sign that says Bridges to Beauty. Dr. McIntyre Bridges, thanks so much.
Oh,
Great to
you're
see you.
welcome.
That's going to do it for us for Healthline 3. Have a great day, everyone. Bye-bye.